Good afternoon. This is a presentation poster investigating lymphatic disorders, malignancies, and naturopathic management for the 22nd Annual Discovery on Target Cambridge Health Institute Conference. This presentation is coming to you from Scottsdale, Arizona. Sorry, we cannot make the trip out to Boston for this wonderful presentation and conference, but we look forward to joining in via the app. Amy K. French is a certified lymphedema therapist and a licensed massage therapist. She contributed some of the physical medicine approaches to this poster. And my name is Gabe James. I'm a fourth-year medical student at the Sonoran University School of Health Sciences in Tempe, Arizona. I'm in the Naturopathic School of Medicine, about to graduate, and I'm affiliated with the Rick Scalzo Institute for Botanical Research. Any dosages or any information that we go over in this poster is from research. It's not intended as any sort of recommendation for treatment. We ask that you consult with your healthcare physician, as we are not allowed to give any medical advice or make any recommendations for treatment. So we're going to zoom in here. So if you're following along, you don't have to squint your eyes. So when we were going through our literature searches, lymphedema, 1 in 5 women treated for breast cancer is afflicted by breast cancer related lymphedema. And I think it's like 1 in 8 women that will carry a diagnosis of breast cancer throughout their lifetime. So this is a fairly relevant condition that a lot of medical schools don't teach a ton about. This is why one of the reasons we wanted to bring this and provide some education. Complete decongestive therapy is the gold standard of lymphedema treatment, and that's a mixture of modalities where we move the lymphatic flow channels, push the lymph back into the blood vessels of the venous, return to the heart, and also work with the extracellular fluid outside of the cells for maximum movement with the pushing pressure, the hydrostatic pressure, and the pulling pressure, the different osmolallic gradients that are out there. Part of this poster does dive into the world of blood cancers and lymphomas and how integrative modalities can improve quality of life in conjunction with standard of care NCCN guideline. And there are some naturopathic modalities that are NCCN approved that help persons afflicted with a cancer diagnosis, such as acupuncture being one. We also wanted to dive into the world of lymphedema. While it's not an official ICD-10 diagnosis, millions are afflicted, and there are certified lymphedema therapists and complete decongestive therapy that is helpful with people that are afflicted with that. And then one of our big conclusions with references to randomized controlled trials is that herbal medicine can synergistically help traditional endocrinology, hormone-based therapies, such as your selective estrogen receptor metabolites, your tamoxifens, and your aromatase inhibitors for your postmenopausal patients, your anastrozole, letrozoles for estrogen receptor positive breast cancer patients. So we'll scroll over here. Amy K. French helped develop this first slide, and these are some physical medicine approaches. So lymphedema is an abnormal collection of lymphatic fluid beneath the skin. It causes an increase in pressure in a compartment. When these lymphatic vessels and nodes are impaired or missing, the system becomes overloaded, causing the backup fluid, which we call edema in the medical world. Signs and symptoms for clinicians to keep an eye out for: swelling, tightness, aching, skin changes, heaviness, constriction. I know it's important to think of differential diagnoses for me as a medical student. So, if it's a unilateral swelling of an arm or a leg, you always want to the red flags that are more emergent, such as a DVT or a blood clot. So you want to send those patients for diagnostic ultrasound-based images before you jump the gun and make like a lymphedema diagnosis. So the prevalence of cancer-related lymphedema of patients undergoing some sort of treatment, the head and neck for be it squamous cell cancer or whatever other melanoma, basal cell, whatever type of Mohs procedure they might have had if you are going into the lymph nodes of the head and neck. There's tons of them, as you can see on the right here, and they all drain into the blood vessels. This is like a very intricate system of lymphatics. So it's kind of not surprising that the head and neck, 90% of those, there'll be some sort of complication post-surgical procedure. Now, the number of those is not nearly as high as breast cancer. I'm sure some of these surgical techniques are getting way more dialed in, but at the time of this research, we found that about 47% of breast cancer, cancer-related lymphedema. You can see the sentinel node, which is often biopsied, and it often is the deciding factor when you're staging breast cancer. If it's in the lymph node, it's stage 2. If it's not, then you could say it's stage 1. So what is complete decongestive therapy? Well, it's the gold standard of lymphedema treatment. The goal of the providers giving this care is to reduce lymphedema volume, lower cellulitis risk, and achieve self-sufficiency for improved long-term health and quality of life. Obviously, there's a risk of infection in these patients. So complete decongestive therapy, you can 2 phases, the decongestion and the maintenance phase. In America, in the insurance models, usually the decongestive post surgery with a cancer diagnosis is going to be covered and be billed through some sort of physical therapist through the journey with cancer, compression bandages, exercise, skin care. And these are strictly physical modalities. We haven't yet gone into any of the dietary, exercises, medicine, lifestyle changes. And then the maintenance phase, because lymphedema is not curative, although there are some microsurgeries in the Boston area for primary lymphedema for kids that are having some really good success with robotics, and like really the lymphatic vessels are just so delicate that traditional surgery, it's really hard to go in there and fix those. But compression garments are like standard of care, wrapping, and just all around good maintenance. So we want to, on the poster, we're not going to dive into this as much, but there are some naturopathic nutraceutical approaches to breast cancer, and we wanted to show you some of the pathways. Like we said before, none of these doses are intended as recommendations for you to forego any sort of doctor-approved traditional therapy. If you're on a SERM or an AI, we're not trying to give medical advice here. But there are some good studies out there that show via these different pathways, products such as indole 3-carbinol, DIM, and then the compounds found in raw broccoli can be helpful. Here, modified citrus pectin, which targets galectin-3, is often used in the world of naturopathic oncology. The American Association of Naturopathic Physicians has a branch called the Oncology Association of Naturopathic Physicians, and there are about 100 in North America fellows of the American Board of Naturopathic Oncology that have gone through rigorous testing and training. So I'd suggest that if you're interested, or you find one of those FABNOs for your integrative cancer care. There is IV therapy that is offered before or after traditional chemotherapy infusions. That's listed here. If if you're interested, this is some of what's used out there in the world of naturopathic oncology. We also wanted to show you the pathways and the detox pathways. You get your liver pathways. So here at the Rick Scalzo Institute for Botanical Research in Tempe, Arizona, on the campus of the Sonoran University of Health Sciences, we have a level 2 facility, cell cultures, viruses, and we do a lot of studying. These are just a handful of the herbs that we work with. The golden flower here is calendula, which is well known to traditional healthcare providers as like in a topical form for wound healing. There's also here the purple coneflower, the echinacea, to brighten up the poster. But there is good efficacy and research among a bunch of different compounds that are found in a lot of these herbal medicines that are listed here, these lymphagogue herbs. There's some studies out there on homeopathic injectable Trameal, which I think you can do in Europe. I don't know if it's still available in the United States. Maybe it is in Canada. And then there's some TCM, traditional Chinese medicine, herbal blends with astragalus that have showed some good efficacy out there. There are some pictures here of what it looks like for a patient with lymphedema to undergo some of the bandage wrapping along the lymphatic channels. You can see there. And then there's also a pilot study that demonstrates the benefits of anti-inflammatory therapy in human lymphedema in patients that are going through that journey. There are different stages of lymphedema. We want to catch it at the earlier stages if we can, less risk of progression and less complications. Patients that are afflicted with lymphedema often have to avoid direct UV light to the area. Heat is a factor that could be bothersome to some of these patients. So there's kind of like they plan their day around. There are compression pumps that some insurances will pay for these patients to use at home, in addition to going to see a physical therapist if their insurance will cover that. Okay, we're gonna switch over this way. And we wanted to go over some of the diagnostic markers. So here you see the stemmer sign on the right. If it's positive, that means that it's likely lymphedema. And what a positive stemmer sign is, you take that like second toe and you pinch the skin, like you're kind of checking for hydration. And the fold in the skin at the base of the second toe cannot be pinched and lifted. You get some extracellular fluid there, and it's likely lymphedema. Negative, normal. You know, if it takes a while to go back, then obviously it could be a dehydration thing. One of the core principles of naturopathic medicine is doctor as teacher. So that's why we wanted to include some pictures of some of the compression garments that are out there that help patients with their journeys through lymphedema. Also, there's a label there for some of the T-pills that are being used by some healthcare providers. And I'm going to scroll up because even though there's some potential contraindications for sticking any sort of needle directly into a lymphedema appendage, there is some really good data for acupuncture points for lymphedema, and how if you treat those organ channels above or below whatever the lymphatic lesion is, you can move the blood and chi stagnation, or whatever the diagnosis is in the traditional Chinese medicine sense. There are some companies out there that have lymphagogues, grape seed extract, diamesin. There's all these flavonoid type compounds in the botanical world, which in theory strengthen capillary and lymphatic vessels, thereby minimizing lymphatic and vascular blood vessel leakiness is kind of the idea behind all of this when we were reading through our studies. Lymphatic system does play a pivotal role in the pathophysiology of many malignancies. It's important to understand lymph drainage, like we learned in anatomy as medical students, from lymphomas to breast cancer-related lymphedema. Any sort of imbalance in lymph can be debilitating for our patients on a microscopic level. These cancer cells, they can be transient as they're beat a blood cancer or a solid tumor as they're traveling. If the lymphatic system isn't impaired in any way such that there's backup, you could seed other areas with these cells. There is an infectious cause to lymphedema. Didn't want to skip over that. The World Health Organization states that there's a parasite out there that causes lymphatic filariasis. And there's some data and stats on those there. And then we wanted to, oh, sorry about that. Wanted to get you over to this side of the poster to talk about lipidemia, like we started with. There are some differences, and here's some comparisons on those. ICD-10 wise, as of this recording in fall of 2024, for diagnosis, it's one and the same. But lipidemia, painful fat is what it comes down to, is a common adipose tissue disorder that is believed, some statistics set up to 11% of adult women worldwide. So I think it's important as a healthcare practitioner not to be dismissive of any lipedema presentation, to say that it's a metabolic disorder, or to, maybe push the patient towards some of these off-label use of some of the very popular diabetes medications that are coming on market. But find the root cause is what we're taught in naturopathic medicine, and work with the patients and not to be dismissive. So we did want to share a naturopathic case study on secondary lymphedema that we will be taking out to the Society of Integrative Oncology, which is well respected in the world of allopathic medicine. It's within the National Comprehensive Cancer Network guidelines. So things for like cancer-related fatigue, acupuncture, and then there's also some studies out there on cannabis for nausea. But you can read over that if you're interested. This is all posted on the NICE app that the Cambridge Health Institute has made available for us for the poster. The lymphatic channels here on the right, this shows you how they kind of drain up. Both lower limbs drain up via the pelvic area to the cisterna underneath the diaphragm, which takes it over to the thoracic duct and then dumps it in to the area where the internal jugular vein meets the subclavian to form like the brachiocephalic and into the superior vena cava, excuse me. There are some homeopathic treatments out of India, the Banjari protocols. Wanted to share the breast cancer ones to you. These are not standalone, is my understanding, but some of the popular ones homeopathically are carcinoma and phytolacca. And then there are some microsurgeries going out there for a lot of these kiddos that have the diagnosis of primary lymphedema. There are some clinical trials and studies where they're doing some like kind of reconstruction of some of these lymph, very delicate vessels, and rerouting some of the anastomosis, some of like the connections. Wanted to share with you some of the, we got cut off there, but the B symptoms of lymphoma, really any cancer, red flags as a clinician you might keep an eye out for and have your spidey senses go up. Night sweats, losing weight without plans, and any sort of like ongoing high-grade fever. This was really interesting. The axillary treatment and chronic breast cancer-related lymphedema, implications for prospective surveillance and intervention from a randomized controlled trial. I think where we are going in the future of cancer genetics and liquid-based tissue kind of biopsies is that we might see a downtick in patients with secondary lymphedema. Obviously, you need really good imaging to make sure that any sort of metastasis hasn't gone to the lymphatic system. But if we can get more sensitive and more specific with some of our blood draws and some of these companies out there, be it cancer detection or staging the cancers, in addition to the tumor genetics, maybe in the future we won't have to surgically be as aggressive with so many of these lymph nodes, which the ramifications later in life is a diagnosis of lymphedema, which can be managed with physical therapy, complete decongestive therapy. Obviously, this is a risk versus reward that should be between the clinician through and the patients in a shared decision making. What's best for less chance of reoccurrence of the cancer and overall quality of life. We wanted to thank you for your time and attention, and then point out to you that if you do have any questions, you can reach us at the Rick Scalzo Institute for Botanical Research in Tempe, Arizona, or the Pink Ribbon Lymphatic Massage if it's more for the physical medicine out here in Scottsdale, Arizona. The Sonoran University of Health Sciences School of Naturopathic Medicine is thankful to the committee of the Cambridge Health Institute that put on the Discovery on Target 22nd Annual Industries Premier Event on novel drug targets and therapeutics, and allowing us to present some of our research into lymphatic disorders, some physical medicine, botanical medicine, traditional Chinese medicine, homeopathy, and we did find some promising studies with some non-steroidal anti-inflammatory, since this is a drug industry sponsored conference. We didn't want to totally go opposite, but we do look forward to working integratively with anyone out there that wants to possibly partner with the Rick Scalzo Institute for Botanical Research. We did leave some information on the website if you'd like to reach out to us on the app, the Cambridge Health Institute Discovery on Target app. You can see there d.james@scnm.edu or d.james@sonoran.edu would be the best way for me to get you in touch with our principal investigators, our research scientists, if you're interested in partnering. And I am going to turn this off.